Hello and welcome to today's webinar, Understanding Microcirculation and Supportive Botanicals, presented by Berris Burgoyne. I am Megan Hamrock. I'm the Nutrition Learning Manager for Standard Process and will be here tonight moderating this webinar. Thank you for taking the time to join us today as Berris will explain the new understanding of microcirculation as well as common microcirculation and endothelial dysfunctions. Berris will also review recent research for a number of key botanicals, including Bilberry, Gotu Kola, and Ginkgo, and how these herbs support microcirculatory health. We appreciate your dedication to learning and are honored to have you support both the MediHerb and Standard Process product lines. Before we get started with today's presentation, I have a few housekeeping items to cover, and while I do so, displayed on the screen before you is a brief disclaimer for you to read. As Berris presents today, we'll open the session up for questions at the end. So if you have any questions during the presentation, please type into the question box and we'll get to as many as time allows. Please note that we cannot address questions that reference disease states or are seeking specific patient recommendations. You will also find the slides as a PDF in the handout section of GoToWebinar. We are recording today's webinar and it will be posted on the Standard Process website in the near future. So now a few words about Berris before we get started. Berris Burgoyne is a renowned naturopathic clinician with 30 years of experience. She owns and runs a highly successful naturopathic clinic in Brisbane, Australia, and is a senior member of the MediHerb team as a technical writer and educator. Berris was one of the first herbal students of Carrie Bone and has worked closely with him for over the past 26 years. She regularly lectures alongside Carrie in Australia and New Zealand and has also lectured extensively in the United States, Canada, the United Kingdom, and South Africa. What sets Berris apart as a speaker and educator is her ability to take very complex technical data and transform it into practical clinical information that is easy to understand and apply. This, coupled with her extensive clinical experience, makes her an authoritative and dynamic presenter. So with that, it is my pleasure to introduce to you Berris Burgoyne. Berris.
Thank you very much, everybody. It's a real pleasure to be with you this evening to present this very important topic. So the efficient functioning of the microcirculation is fundamental to good health. It's responsible for delivering the oxygen and the nutrients to every tissue in the body, and also for removing the waste products from those tissues. When things go wrong, we see microvascular dysfunction, and it's associated with a whole range of chronic conditions, including Alzheimer's disease, cardiovascular disease, a range of serious eye conditions, obesity and diabetes, as well as being involved in the development of diabetic complications. We're very fortunate to have a number of herbs that can improve the health and function of the microcirculation. In my presentation this evening, I'm going to be discussing the latest research on these key herbs, and I'll also share with you how I've used these herbs to support patients in my clinic for the past 30 years. So the topics we'll be covering today, we'll look at what is the microcirculation, how does it work, what does it do? We'll look at the conditions associated with it when it goes wrong, and the key herbs to support microcirculation. And we'll be looking at bilberry, Gotu Kola, Ginkgo, and grape seed. So what is the microcirculation? It's actually a vascular network, a very fine vascular network, and it's the final destination of the cardiovascular system. It's referred to sometimes as a business end of the circulation, and I think that's very effective because that's where so much actually happens to support healthy tissues. It consists of the arterioles, the capillaries, and the venules, and it's a huge network spread throughout the body. It's estimated to be almost 4,000 square feet, so it's huge. So there's a lot to look after here. It plays a really important role in modulating vascular tone, so the vasodilation and vasoconstriction of the blood vessels. And that's very important because if that's not happening effectively, one thing that will happen is we're going to have either low blood pressure or high blood pressure. And the microcirculation does this modulation through the release of a whole range of compounds from the endothelial cells. And these include nitric oxide, reactive oxygen species, and arachidonic acid metabolites. And the microcirculation's responsible for most of the resistance in flow that actually modulates blood pressure and tissue perfusion. So if any of this goes wrong, blood pressure is not going to be the way it should, but we're also not going to be delivering nutrients and oxygen correctly to the tissues. And there's a huge amount of concentrated microcirculation in the retina of the eye and the glomeruli of the kidneys. So when you're treating patients with conditions that affect either of these areas, I think it's really important to include microcirculation support as part of the protocol you're using to treat those patients. Now, the capillaries are the very end of the microcirculation. This is where, well, before it connects to the other side. So the capillaries align with a single layer of endothelial cells. And they're very, very fine blood vessels. They're so small that only a single red blood cell can pass through at a time. And even then, the red blood cell has to squish itself down a little bit to get through those fine capillaries. And that's why it's really important to have healthy red blood cells so that they can squish down and fit through those capillaries. So the it's at the capillaries where we see the exchange of the oxygen, the nutrients, the blood-borne hormones, and the removal of the waste products. So all of this happens between the blood and the tissues, and it happens at the level of the capillaries. They also carry immune cells to the site of infection or damage, so the issue can be dealt with. And all of this happens via two different mechanisms, passive diffusion and pinocytosis. Now, the endothelium, this is a layer of cells that line the blood vessels. And we've already seen that these endothelial cells produce a whole lot of compounds that regulate dilation and contraction of the blood vessels. So they modulate vasomotor tone, permeability, and hemostasis. They also help to regulate our endothelial response, inflammatory responses, angiogenesis, leukocyte traveling, and innate and adaptive immunity. So if we don't have healthy microcirculatory blood vessels, we also don't have a healthy endothelium. And it's the endothelium that plays a role in modulating and regulating all of these things. If we have endothelial dysfunction, we can see an imbalance between all those compounds that are released from the endothelial cells and the relaxing and contracting factors that they produce. So we see a shift towards more vasodilation. And of course, we're going to see increased blood pressure with that, but we're also going to see an inflammatory, a proliferative, and a prothrombotic state. We see reduced nitric oxide bioavailability, and this is really a hallmark of endothelial dysfunction. Now, at the end, I'm going to show you Kerry Bone's microcirculation dietary plan, and you'll see there how we can improve nitric oxide levels with our diet. So if we look at microvascular dysfunction, the microvascular, any sort of microvascular disease, and really we're talking about dysfunction here, is a multi-system disorder because the microcirculation covers the whole body. And it can affect different organs differently when things go wrong. We can see dysfunctioning of signaling within the microcirculation, and that's recognized as an etiological factor in a growing number of diseases. And we're going to be looking at some of those diseases. Now, these images that you can see here, they just show two different ways in which microvascular function and endothelial function can be measured. And one of them is is using a laser on the forearm, another is using a different type of laser on the nail bed that really looks at the capillaries. And both of these are really efficient, fast and non-invasive ways of measuring the microvascular and endothelial health systemically, not just in the area that they're imaging. So there are ways that this can be assessed very, very easily. So now if we have a look at some conditions that are associated with microvascular dysfunction, and you'll see there's a lot of them, and I'm just talking about each one very briefly because we don't have time to go into them in detail. There's a disturbance in microcirculation very early on in a number of different cardiovascular risk factors, including obesity, diabetes, hypertension, and dyslipidemia. We can see how it can happen with hypertension, with the changes in dilation and contraction of the blood vessels when the endothelium is not working well. But once people have obesity, it's also a well-established risk factor for microvascular dysfunction throughout the body. And it's thought that it's this microvascular dysfunction that can explain things like the exercise intolerance, chronic kidney disease, dementia, coronary microvascular dysfunction, which I'm going to talk about a little bit later, heart failure and pulmonary hypertension that we see in obese patients. And when it comes to diabetic patients, microvascular dysfunction leads to many of the complications, including retinopathy, neuropathy, and nephropathy, and also increases the risk of cardiovascular complications. So in our obese patients, it's really important to be supporting microcirculation along with everything else we're going to be doing with those patients. So if we go on to the musculoskeletal system, and for the chiropractors listening, this is an area that you're dealing with a lot in your daily practice. So what has been found is that age-related decrease, and we know that microcirculation does decrease over time, with those changes we see decreased perfusion of the lumbar vertebral marrow. And this precedes the loss of bone mineral density, so osteopenia, osteoporosis, and it also precedes the onset of intervertebral disc degeneration. And what we're seeing more and more with chronic disease is that early changes in microcirculation is also an early event in these conditions, long before you get symptoms and sometimes before you even see any changes on imaging or other testing. We also see the same thing happening in osteoarthritis. Microcirculatory dysfunction as an early event in the structural changes in osteoarthritis. So we need to be aware of this, and I believe that in our aging patients, I think anyone over about 55 should be having microcirculation support every day, whether it's with a herbal supplement or whether it's with diet. But we must pay attention to our microcirculation and endothelial health as we age. When we look at patients with inflammatory arthritis, and this includes things like rheumatoid arthritis, ankylosing spondylitis, etc., there's altered microcirculation as measured by that scan of the forearm. Now, restless leg syndrome, it's not an uncommon condition, and for people that have it, it's very disturbing and very annoying and can really change their quality of life significantly. We know that for people that have long-term restless leg syndrome, that is a risk factor for silent cerebral microvascular disease. So it's not surprising. It's very likely, in my opinion, that it's dysfunction of microcirculation that is contributing to the restless leg syndrome in the first place. So if it's in the legs, it's going to be elsewhere in the body as well, including in the brain. And these people are at significantly more risk of microvascular, cerebral microvascular disease and gliosis than controls. Now, gliosis is a fibrous proliferation of the glial cells that occurs in areas of injury in the central nervous system. There's also a link between restless leg syndrome and stroke, hypertension, and cardiovascular disease. And this is not always an easy condition to treat, and it's certainly not an easy condition to treat medically. The types of drugs that they use, like dopaminergic drugs, and there's a few others, aren't all that effective, and they do also have side effects. Non-alcoholic fatty liver disease. This is a great concern, of course, in patients who are obese or with type 2 diabetes. Now, the liver sinusoidal endothelial cells, if we see alterations in those, and I'll explain what they are in a moment, if we see alterations and dysfunctions, they occur early in NAFLD, at the stage where we just have simple steatosis. That means we have a little bit of fat accumulating in the liver. We're not going to see any symptoms, and it's probably not going to show up on any test. Now, the liver sinusoid is a type of capillary, and they're called sinusoidal capillaries, and they occur in the liver. So what we're talking about here is the endothelial cells of those special sinusoid capillaries. When these changes happen, they inhibit the ability of these endothelial cells to prevent liver inflammation and fibrosis, and at the point where we get the progression of NAFLD to NASH, these changes also contribute to liver angiogenesis, inflammation, fibrosis, and hepatocellular carcinoma. So in our patients with NAFLD, we absolutely need to be supporting microcirculation. But all of this is another reason why we need to support microcirculation in our obese patients. And these endothelial cells are viewed as the gatekeepers of liver homeostasis in physiological conditions. And improving the function of these endothelial cells has great therapeutic potential for NAFLD, and we can definitely do that. So theoretically, we can use the herbs that support microcirculation in our NAFLD patients, and hopefully that's one of the things we can do to reduce the progression of early NAFLD through to some of the more serious consequences of it. The microcirculation in the liver itself, when it becomes dysfunctional, it's a key factor in the development of cirrhosis, and it's associated with the complications of cirrhosis, including multi-organ dysfunction. Now, NAFLD can progress to cirrhosis as well, but there's a whole range of other things like chronic hepatitis B, hepatitis C, alcoholism. There's a whole range of things that can also cause cirrhosis. Cataracts, this is a really common problem, and fortunately we have very simple effective therapies that are very commonly used in developed countries and very readily available to deal with cataracts, because they're the most common cause of blindness throughout the developing world. So the effectiveness of the lens is maintained by an internal microcirculation system. So if we don't have good microcirculation to the lens, we're not going to have healthy lens. Protein oxidation within the lens can lead to impaired microcirculation and a depletion of nutrients and antioxidants, because they can't get into the area because of the dysfunction that occurs there. Aging and reduction of the antioxidants leads to failure of microcirculation and an impairment of our vision. So we can improve the antioxidant status, our endogenous antioxidant status, by improving NRF2. And, you know, we've talked about NRF2 a lot in our presentations, and I'm sure you all have a list of NRF2 supporting herbs somewhere. But some of the herbs that support microcirculation, like ginkgo and grape seed, which I'm talking about tonight, but also garlic, they support NRF2 and they also support microcirculation. So in some ways, by supporting microcirculation, we're also supporting NRF2. There's a connection with hypertension as well. Changes in the structure and function of microcirculation, so changes in vasoconstriction and vasodilation, are major determinants in blood pressure in primary hypertension. But then we have a vicious cycle that happens because high blood pressure further damages the microcirculation. So this is an ongoing situation. So when we see patients with hypertension, we have to be giving them herbs and nutrients and advising them about lifestyle and diet to bring their blood pressure down. But at the same time, we need to be supporting the microcirculation because there's this bidirectional relationship that sets up this vicious cycle that happens. There's a real connection with Alzheimer's disease, which is not surprising. When we see age-related changes in the microvasculature and the endothelium, this can lead to buildup of amyloid beta and can also then increase the adverse effects of that amyloid beta. Another vicious cycle here with the amyloid beta can then cause further degeneration of the vasculature. But it's not just an aging problem because amyloid beta deposits have been found in young individuals 30 to 50 years of age. So, and we've been hearing for many years that Alzheimer's doesn't just begin when the symptoms start developing, the processes begin many years earlier. So, you know, we're not necessarily going to be thinking in a 30-year-old, unless they've got some condition that warrants it, that we have to support their microcirculation. But what we have to be doing is be encouraging them to eat a diet that is healthy and in doing so also supports microcirculation. Restoring blood flow in the early stages of Alzheimer's could limit dementia progression. So it's another arrow in our bow, if you like, that we can use in patients that we see with Alzheimer's, particularly if we see them very early on in the diagnosis. Supporting the microcirculation is paramount to trying to reduce the progression. So when we look at the vasculature of the brain, you see on the left there, healthy brain, on the right, the Alzheimer's brain, and that grey mesh in the middle of the arteries and the veins is the microcirculation. And you can see in the Alzheimer's brain, it's all broken, it's not connected, it's not obviously not working well. And the yellow dots represent the amyloid beta plaques, and the purple dots represent immune cells that have gone in there, neutrophils that have gone in there to actually try and deal with the damage. And they can also reduce the blood flow in that network. But we also get changes in the arteries and veins. We get distortion, and quite often there's a real narrowing of those major blood vessels. So it's supporting microcirculation is extremely important. Now, on this slide, I didn't have time to go into all the conditions associated with microcirculation dysfunction, but so I put a lot on this slide for you. And so I've got the condition and whether it's a cause of microvascular dysfunction or a consequence, and you can see most of them are consequences of microvascular dysfunction. And you know, when I was reading the research, I'd often just read that there's an association between obstructive sleep apnea and microcirculation, for example. And I'd be thinking, well, is it a cause or is it a consequence? And so, you know, I've read a lot of research papers to put this little table together for you. So I just want to talk about a couple of points here. We don't have time to go into them all. But if we look at ischemic stroke, People with peripheral, microvascular and endothelial dysfunction have a threefold risk of having an ischemic stroke. So we have to look after the microcirculation in our aging patients. And then if we look at schizophrenia, it's thought that it could be caused by vascular ischemia in the brain. So, and that, you know, there would be other things. It's a very complex condition. Any of these complex conditions, there's not just going to be one thing. But, you know, if you're treating schizophrenic patients, maybe give them microvascular support because it may be beneficial. And depression, peripheral and cerebral microvascular dysfunction are associated with a higher risk of depression later in life. So, and that's not really surprising when we see that there's very likely a component of neuroinflammation in patients suffering with depression. So I'll let you go through that in your own time. The majority of papers I've used and referenced on the next slide will be available as full text articles in PubMed. Now, there's a number of microvascular diseases that affect women more than men, and we have them on this diagram. I'm not going to go through them in detail, but I am going to talk on the next slide about coronary microvascular dysfunction, CMD. And it can be a major issue in women. So coronary microvascular dysfunction is a cause of ischemia without having obstructed coronary arteries. Now, commonly it's been thought if you've got ischemia to the heart muscle, it's because there's obstruction in the coronary arteries. But we now know that's not the case. You can have problems in the small blood vessels, in the microcirculation that's feeding the heart. And this is called INOCA, ischemia with no obstructed coronary arteries. And it can occur in men, but it's much, much more common in women. And because it's not picked up on any of the normal cardiovascular tests like angiographs, for example, like coronary calcium scores, all of that sort of thing, you don't pick this up. So women may present to the emergency room with feeling, you know, they've got chest pain, they're not feeling well, and, you know, well, you don't have obstructed coronary arteries, so you don't have heart disease, so you maybe you're a little bit anxious, just go home and relax. And there's been countless incidences where women have gone home and had a heart attack and died because this hasn't been picked up. There's much more awareness around it now, but there still needs to be a lot more. It plays a fundamental role in hypertrophic cardiomyopathy and heart failure, and particularly microvascular and endothelial dysfunction plays an etiological role in the pathogenesis of heart failure with preserved ejection fraction, and that is the most common form of heart failure experienced by men. By women, I'm sorry, much more so than in men. So it's very important that we're supporting microcirculation in our women as they get a little bit older. The tests that can be done to try and find coronary microvascular dysfunction is a stress echo test, where, you know, they do the CT scan, the ultrasound before the exercise, then you do the exercise, they do the CT on the heart again afterwards and see if there's any differences. And if there's any areas of the heart muscle that aren't performing well after exercise and there's no obstructed coronary arteries, then it's considered that there's probably coronary microvascular dysfunction. Also now, though, we have coronary MRIs that can pick this up as well. I don't know how readily available they are, and they may be very expensive. Patients with CMD also have peripheral microvascular and endothelial dysfunction. So it's not confined to the heart. We see it throughout the body. So the heart may not be the only problem they have or will develop. So now we can go on to the herbal therapy to support the heart. sought to support the microcirculation and endothelial health. And we have a list for each here, and you can see there's a lot of crossover. Bilberry, ginkgo, grapeseed, garlic look after both microcirculation and endothelial health. But I think if you can really support healthy microcirculation, you're automatically going to be supporting healthy endothelial health. So the first herb I'm going to talk about is bilberry. And these beautiful purple berries, purple outside and purple inside, a little bit different from blueberries, have been consumed since ancient times for thousands of years as part of the diet and as medicine. And the key active constituents, the main ones, are the anthocyanins. There's also flavonoids and procyanins. And the key actions are vasoprotective, anti-edema. They support microcirculation and have strong antioxidant effect. So if we look at clinical applications, capillary fragility and bleeding gums, I'm going to talk a little bit about gingivitis later. Anywhere we've got weakness in blood vessels, really, hemorrhoids, varicose veins, varicose insufficiency, especially in pregnancy, diabetic and hypertensive retinopathy, we can use them to improve microcirculation and endothelial health, and to improve healing generally, particularly after surgery. And I often combine bilberry with Gotu Kola, which is another good healing herb. They both support microcirculation, and that's probably the major way in which they're such good healing herbs. Eye problems like macular degeneration, glaucoma, eye strain, and I'll be talking about a little bit of research for these, and also night blindness and myopia, which is nearsightedness. And we can use bilberry as a conjunctive treatment for cardiovascular disease, but also to support general cardiovascular health, to maintain cardiovascular health, particularly in our aging patients. We can see an improvement in a whole range of vascular and venous disorders, which isn't surprising given what we've seen on the previous slide. So lower limbs, varicose veins, etc. Improve microcirculation and lymph drainage in patients with venous insufficiency. Hemorrhoids during pregnancy, and they can be quite common in pregnancy. Can reduce nosebleed that's caused by abnormal capillary fragility. And we probably all know in someone, or maybe experienced ourselves, that has really easy nosebleeds. It just happens spontaneously because of these abnormal fragility of the capillaries. And to reduce symptoms of dysmenorrhea, and I'll show you a study about that later. And this was interesting, where finger joint mobilization was improved in patients with Raynaud's. But again, it's not really surprising, because Raynaud's is really just spasm in the arterioles, in the fingers. So if we can improve the microcirculation and push it through, that's going to be beneficial. But we can also use herbs that can relax the blood vessels. So some of our spasmolytic herbs we can use there as well. Now I'm going to go through some eye conditions now. We're going to start with ocular fatigue, and I've got 2 slides where I've condensed the research onto tables, because there definitely is not time to talk about all of this research. So on the left-hand side, we have the study design and then the dose of bilberry that was used, and it gives us the level of anthocyanins. And then on the right-hand side, the outcomes. Now, I use a bilberry tablet in my clinic that contains 39.9 milligrams of anthocyanins, and so we may as well say 40 milligrams really. So you can see that using a tablet like that, it's not hard to reach the levels of anthocyanins that have been used in these clinical studies. And an interesting one down the bottom there is healthy adults whose jobs involved visual terminal displays, so really just using a computer a lot of the time. And then if we go to the next slide, the same setup, and you can see here there was a study with a 4-week study where they used a video game console for 45 minutes before examination, and they found that the bilberry was very beneficial. So when we're using screens for long periods of time, we really see changes in the muscles that control the eyes. We see fatigue and tension, and this changes how the eye focuses, how it adjusts to focus. And of course, we see more and more young people on screens all the time. So, you know, that can lead to focus problems in the long term. So normal tension glaucoma, this was a study where they looked at 2 herbs. They used 120 milligrams of bilberry anthocyanins. So that was just the isolated constituents. And they also used ginkgo, 160 milligrams of ginkgo extract per day. Now, I've already said the bilberry tablet I use contains 40 milligrams of anthocyanins. And I also use a ginkgo tablet very commonly in my clinic as well. And each tablet contains 60 milligrams of the exact extract that was used in this trial. So again, you can see it's easy to replicate these. And then, of course, there was a control group. And what they found was that visual field was significantly improved in both treatment groups, but only bilberry anthocyanins improved visual acuity, which was worsened in the control group. So we could look at that and think, well, ginkgo didn't have an effect, but ginkgo may have had an effect because it worsened in the control group. So the ginkgo may have stopped the progression. And the researchers thought the results were most likely due to improvement in ocular circulation, so microcirculation, and antioxidant effects, which both of these herbs have. So if you're dealing with patients with normal tension glaucoma, you could use bilberry, well, any sort of glaucoma really, I think. You could use bilberry and ginkgo. And this study was done with open angle glaucoma. Now, normal tension glaucoma is a subset of open angle glaucoma, but there's lower intraocular pressure in normal tension glaucoma than there is in this one. So this was a small study just with 18 patients. And what they did here was they combined bilberry with French maritime pine bark. Now, I don't have the pine bark in my clinic, but you can see the active constituents of procyanidins. And so I use grapeseed in my clinic very commonly, and grapeseed has very similar procyanidins. So I will often swap over and use the grapeseed when I see these sorts of studies along with the bilberry. And, you know, I often use a combination of Gotu Kola, grapeseed, and ginkgo, because all of those herbs support microcirculation. And the grapeseed extract in that combination that I use has 25.5 milligrams of procyanidins in it. Intraocular pressure was decreased by 50% in 9 participants. It was unchanged in 6, and for some reason, it was elevated in 3 participants. This was another study with 88 patients with increased intraocular pressure without glaucoma. They were using eye drops, and the combination of bilberry and the French pine bark, so I would use bilberry and grapeseed extract, decreased the intraocular pressure and improved retinal microcirculation. And the addition of the herbs was marginally better than just using the eye drops alone. And macular degeneration. Now, this was a study that used a combination product, and I don't normally use these because we don't often have access to the exact supplement. But I put it in because there's Ganoderma there, and I use Ganoderma and shiitake routinely in my clinic. And I know that many of you are using nutritionals, and you may be well using some of these nutritionals. So there was improvement in macular degeneration with this combination. And we'll see later that ginkgo can be beneficial in macular degeneration as well. So a study with 64 children who had high myopia. And in this study, there were 32 children in the treatment group, and they gave them one tablet twice a day, just for 20 days each month for 1 year. And that tablet contained bilberry. It was just the anthocyanins, 50 milligrams, and the also had vitamin E in it. So they treated the children for 1 year, and then they also followed up for another year. And during that 2 years, they did tests every 2 months. And they found that the treatment was associated with slowing of myopia progression, and that the effects were consistent even in that year where the children weren't taking the herbs anymore. So that's a great outcome for the bilberry and the vitamin E, and it's easy to supplement with vitamin E. So as I said, the bilberry that I use has 40 milligrams of anthocyanins, so very easy to get this sort of dose. Now, if we look at cardiometabolic issues, we know that patients with impaired glucose tolerance or type 2 diabetes, or this was a study where they were controlled by diet and lifestyle, and then when they were given a single dose of bilberry extract that contained 170 milligrams of anthocyanins, there was a reduction in postprandial glycemia and the high insulin levels. And then there were some studies done using dietary bilberries at different doses, and we saw reduction in the inflammatory markers like high sensitivity CRP, and we saw changes in the dyslipidemia with reduction in total cholesterol, LDL, etc., and an increase in HDL, and importantly, a reduction in the liver enzyme GGT and a reduction in blood glucose by having dietary bilberries. So this is something we can tell our patients about, and we can supplement on top of that if need be. But if we can get people including these things in their daily diet, they're going to need to take less supplements. Now, I'm going to talk about the Bear Smart study, and this was a prospective open label randomized controlled trial where they looked at patients who had just had a myocardial infarct. There were 50 patients in the study. The Bear Smart, actually stands for bilberry as a dietary supplement after myocardial infarction. That's how they came up with the name. So this is a dietary intervention. So they used 40 milligrams of bilberry powder, which was equivalent to about 17 ounces. And they 17 ounces of fresh berries, they were still receiving their medical treatment that would normally be given post-heart attack. And bilberry actually improved 6-minute walking distance compared to controls and from baseline. And also compared to baseline, the bilberry group had significant reductions in total cholesterol, LDL cholesterol, and oxidized LDL, which is extremely important. So now another couple of tables for you, set out in the same way that I spoke about before. Now, all of these studies use isolated anthocyanins from bilberry and blackcurrant, so a combination. And they use quite a high dose, 160 milligrams of anthocyanins twice a day, so a total of 320 daily, which is quite high. And I don't use blackcurrant in my clinic. So the reason I'm showing you these is because there were good outcomes from the anthocyanins. And when we're dealing with patients with cardiometabolic issues, we know we have to support the microcirculation, and we have a lot of herbs that can do that. So I'm going to be using bilberry in these patients. I'm going to be using that combination of Gotu Kola, Ginkgo, and Grape seed to further reduce, to improve microcirculation, to improve antioxidant status, to have an anti-inflammatory effect, to provide healing, etc. But we're also going to be giving these patients other herbal medicines and nutrition, depending on what's wrong with them and how they're presenting. And we're also going to be discussing lifestyle and diet. So when we're doing all of that, we don't necessarily need such a high dose of the total anthocyanins. And you can see here, there were people with type 2 diabetes, pre-diabetes, early untreated diabetes, dyslipidemia, and then on this slide, NAFLD and hypercholesterolemia. So good results in all of these studies. So just keep in mind that even though we might not provide this amount of anthocyanins from these particular herbs, there's a whole lot of other things we're doing as well. So this was another study that used that same combination of bilberry and blackcurrant, but they used lower doses as well as the 320 milligrams a day. And there was good results with the 320 milligrams a day, but even at the 80 milligrams of anthocyanins a day, there was an improvement in ApoA1. And ApoA1 is one of the primary protein components of HDL, so it's very protective. So if it's decreased and we can increase it, which is what happened here, then that's going to be very protective for the cardiovascular system. So we can easily give 80 milligrams a day of anthocyanins from bilberry. I do that with those tablets that I use. And in this study with just 40 milligrams a day, the results weren't significant compared to placebo, but there was significant change compared to baseline. So even at that 40 milligram dose, there were benefits. So we don't necessarily need that really high dose. And I said earlier I would talk about gingivitis. And I think gingivitis flies under the radar far too often. It's actually a contributing factor to a whole range of chronic diseases, and it's much more common than we might think. Now, one of the key symptoms is bleeding gums, and usually they're going to bleed when we clean our teeth, and that's a question I usually ask my patients. But when doctors are checking your gums, they're going to be probing them to see if they bleed. So that's BOP. So let's have a look. So BOP was reduced in 41 and 59% of patients who were given dietary fresh bilberries at a dose of 250 milligrams, so round about, I think that's about 8 ounces, or 500 milligrams, round about 16 ounces, and the study was done for 7 days. There was a reduction compared to baseline in inflammatory cytokines in the group consuming the higher amount. So a fair amount of bilberries, or you could use other berries per day, because I don't know, we can't get bilberries in Australia, and I'm assuming you don't get them from the supermarkets in the US either. Now, when we look at standard sort of treatments like debridement, which is simply just going to your dentist and getting your teeth clean and getting rid of all that tartar and plaque, and also having better hygiene, oral hygiene, there was a 58% reduction. So pretty similar to having the high amount of bilberries in the diet. But what was really interesting with this study, there's a really high improvement in the placebo group as well. And the researchers sort of figured that because these people, everybody knew, of course, they were taking part in a study on gingivitis, that these people actually took better care of their oral hygiene and cleaning their teeth, etc., just either consciously or subconsciously. So that's what gave the high percentage in the placebo group, but it's very interesting. And dysmenorrhea. Now, in this study, there was 115 milligrams of anthocyanins, and they gave these 3 days before the menstrual period and during that time. And they found that all the symptoms associated around that time decreased. The dysmenorrhea, but also breast pain, headaches, nausea, heaviness of limbs, etc., and the back pain, all things that women might experience along with the dysmenorrhea. And why is that the case? Simply because dysmenorrhea can be caused by the uterine muscles contracting and that causing uterine ischemia and hypoxia. So if we can improve the circulation, we can do very well there. And of course, ginger is a really nice herb also to use around this time because it supports macrocirculation. And here we have herbs that support microcirculation. Now, bilberry safety, it's a safe herb, but we do have to be cautious if we're using doses of above 40 milligrams a day of anthocyanin. So for me, I'd be thinking, well, I shouldn't use more than 2 of the tablets that I use in patients with hemorrhagic disorders or those taking antiplatelet or anticoagulant drugs. So now we'll move on to the other herbs. And I'll go through these fairly quickly. So Gotu Kola, it's a really good tonic herb. It's one of the Rasayana herbs in Ayurvedic medicine. So it's rejuvenative, it's restorative, etc. Now the clinical trials for Gotu Kola have all used the isolated triterpenes at doses of 60 to 180 milligrams per day. Now, and these have been called different names. It's all the same thing, but they're called different names in the research. And I've listed those names, the TTF, TECA, and the ETCA. So just if you're reading the research and you see these terms, you know what it is. It's these isolated triterpenes. So in patients with microvascular damage due to diabetes, giving 120 milligrams a day of these triterpenes improved microvascular parameters and edema. Now, that combination tablet I mentioned that I use, Gotu Kola, Ginkgo, and Grape seed, in the Gotu Kola, there's 50 milligrams of triterpenes. And I routinely prescribe that 2 tablets twice a day. And I take 2 tablets twice a day of that tablet myself because it's such a good healthy aging formula overall. At 60 milligrams a day, there was improvement in microscopic vascular damage and including capillary permeability. There was reduced severity of symptoms of diabetic neuropathy in patients with type 2 diabetes. And this is an interesting one. There was stabilization of low density arterial plaques. And in these studies, they used the carotid arteries and femoral arteries, but we know that these plaques in the coronary arteries can lead to a heart attack, particularly if they're low density or vulnerable plaques. Most heart attacks are caused by these vulnerable plaques rupturing. So if we have anything that can help stabilize these low density plaques, we can not only improve peripheral circulation if there's plaques in the arteries, but we can also support coronary, reduce the risk of heart attack basically. And that was just at 180 milligrams of these triterpenes per day. So if I'm using 4 of those tablets today, then that's going to be protective. And if we look at Ginkgo, improved retinal blood flow in patients with normal tension glaucoma and diabetic retinopathy. Reduced abnormal blood parameters in diabetic retinopathy, so decreasing clotting factors and red blood cell deformity. And remember I said before about the red blood cells squeezing through the capillaries? If they're not really flexible, or if they've changed significantly in shape, they can't get through those blood vessels. There was improved blood viscosity and elasticity that resulted in improved overall capillary flow to the retina. Improved vascular endothelial function in patients with early stage diabetic nephropathy. So along with bilberry, we need to be using ginkgo in our diabetic and obese patients. Ginkgo also normalized the effects of blood flow, and when they tested it on the forefoot. And this is interesting. In patients that had impaired circulation, ginkgo improved it, but in patients that had hypercirculation, ginkgo normalized it, so reduced it. And when they did the forearm test, and nail fold test, they found there was improved capillary blood flow with ginkgo. We've talked about those sinusoidal cells in the liver, and here we see that improved liver microcirculation, and ginkgo improved the liver microcirculation and protected endothelial cells in patients with hepatitis B. But we're going to get liver damage in patients with hepatitis B, hepatitis C, taking alcohol, having NAFL, etc., and a whole range of illicit drugs, but also a lot of prescription drugs are quite damaging to the liver as well. So if we can use something like ginkgo, bilberry, etc., and the other herbs I'm talking about to improve microcirculation, we can help protect against damage, and of course team them with the milk thistle, which is a great hepatoprotective and trophobrestorative herb. Also, we saw improved cerebral perfusion in elderly males and in patients with vascular cognitive impairment. And grapeseed, the last herb we'll talk about. Now, I mentioned before that the combination product that I use containing some of the herbs I'm talking about has 25.5 milligrams of the anthocyanins in it. But I also use another product that has green tea, grapeseed, turmeric and rosemary in it. And in that one, the grapeseed, the procyanidins actually are 42.5 milligrams. So, and a lot of the herbs in that formula also support microcirculation. So, you know, I have a number of options here depending on the amount of grapeseed and procyanidins I want to be giving to my patients. So in this study, there was beneficial effects on capillary resistance and capillary permeability, improved capillary fragility in elderly patients. And this is a big problem. You know how elderly patients, they just bump their hand, for example, and there'll be that big red patch comes up. That's just all the surface blood vessels have just burst. There was reduced leg swelling after prolonged sitting in healthy women, and that was for 14 days with a good dose of the procyanidins. Improved vascular elasticity and blood pressure in pre-hypertensive patients. That was a fairly high dose of the procyanidins. This study used a slightly lower dose, and what we saw here also was that there was benefits for mood and stress perception as well. So we're probably also increasing microcirculation to the brain, helping the central nervous system deal with life situations, basically. So even though we might not be using such a high dose of these procyanidins from grapeseed in the supplements we're using, because we're using a number of herbs, a number of nutrients, lifestyle changes, etc. As I keep saying, we don't necessarily need these such high doses. There was a positive effect on blood pressure and vascular endothelial function in postmenopausal women, and that's important. And a single dose reduced blood pressure in obese and normal weight males. So in obese people, we saw a reduction in cardiac output, and in the normal weight men, we saw an increase in peripheral vasodilation. So the way that the procyanidins worked was a little bit differently depending on the need in these different groups of people. Now this graph shows the difference between grapeseed and bilberry in cardiometabolic issues. Now, just for the sake of transparency, the bilberry here refers to the combination of bilberry and blackcurrant anthocyanins that we saw in those previous tables that I showed you. And that, it was interesting, that was not really apparent in this paper. I only found that out by reading some of the primary references in this paper. So I'm not going to take you through this in great detail, but you can see here the different effects of both the bilberry and and blackcurrant anthocyanins and the grape seed for fasting blood glucose, HbA1c, total cholesterol, HDL, LDL, systolic and diastolic blood pressure. And you can see that in some of these parameters, grapeseed perform better, in some of the bilberry combination perform better. So, you know, I think use both of these in your cardiometabolic patients, as I do with bilberry, and I use a combination of grapeseed, ginkgo, and Gotu Kola. And just to finish off, here is that 5-point microcirculation dietary plan that Kerry Bone has put together. And I'm sure a lot of you have seen this, but I think it's worth showing it again because it's very good. And it's something that's very, very easy for your patients to implement in their clinics. And I actually print this out and I give it to my patients and say, just try and do some of this every day. And if you can do all of it every day, that's fabulous. But do what you can. Always be conscious about these dietary factors. So we can increase the dietary nitrates with leafy green vegetables, especially raw beets. And we can use it as juice or maybe as raw beets grated in salad, etc. Or we can take a supplement. Increase anthocyanins. We can do that with the dark red and purple and black berries. So 3 to 4 ounces per day. We don't need huge amounts. Chocolate, we can all eat chocolate. The catch is we have to eat dark chocolate with around about 90% cocoa in it. I'm a little bit more lenient with my patients. I'd say, look, start with anything above 75% cocoa and try and work up to the 90%, because if they're used to the nice, yummy, sweet milk chocolate, 90% cocoa chocolate's a bit of a shock. So I actually love it, and that's a chocolate that I eat. So we can increase herbs and spices. We can drink teas like green tea and hibiscus tea that are going to be beneficial. And raw garlic is also very good. So 1/2 to 1 clove a day, but it has to be fresh and crushed. So you can crush it and eat it, or you can, just chew the clove. You could, I guess, crush it and then quickly mix it in a bit of honey and have it. And I think that'd be quite delicious. But most people won't comply with this, and I can do all of these things in my daily diet, but I don't eat raw garlic. I eat a lot of garlic, but I don't normally have it raw like that. But I do take 1 garlic tablet twice a day, just for my cardiovascular and microcirculatory health, because I think that's just a great thing to do as we age as well. So I hope that this presentation has been very beneficial for you. There's been a lot of information in it, but of course it's recorded, so you can go back and listen to it again and again and pause it and take notes, etc. It's a wonderful way to present education. And just before we go to question time, I'd like to thank Professor Kerry Bone and Michelle Morgan. And Michelle actually wrote some of the documents from which I took information for this presentation. So thank you very much.